We absolutely need to significantly ramp up not only the number of tests, but the capacity to actually perform them. I am not overly confident right now at all that we have what it takes to do that. We're getting better and better at it as the weeks go by, but we are not in a situation where we say we're exactly where we want to be with regard to testing.
As you know, and as I've said many times, we're very advanced in testing. Other countries are calling us to find out what are we doing. We've done more testing than every other nation combined. And that's a big statement.
Steve, Fauci, that we're just not there yet.
No, I don't agree with him on that. No, I think we're doing a great job in testing. I don't agree. If he said that, I don't agree with him.
Joining us now, President and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. He's former acting director of the CDC and was appointed by New Jersey Governor Phil Murphy to a multi-state board that's coordinating the region's reopening. I will ask you the same question that was asked of Fauci. Are we where we need to be with testing, and how long is it going to take to get there?
Yeah, I mean, that's the critical question. If we're going to switch from an approach where everyone is on lockdown in their homes to one where we're trying to identify people who are sick quickly, getting them into isolation, figuring out who they've had contact with and getting those people into isolation, we are nowhere near ready to do that. Most states are only testing people who are severely ill to figure out, do they need to be hospitalized and do they have COVID? If you really want to do this right, you need to be able to test people with even the mildest symptoms, because most people who get this infection will do well, but even those people who do well have the possibility of spreading this to others, and we're not ready to identify and contain it with that strategy. We also, there's also challenges in terms of who is getting tested. This is hitting communities of color, Black Americans, Latinos, in a major way, and we don't have any idea of the testing rates in those communities.
Dr. Besser, it's Willie Geist. Great to have you on this morning. You were the acting CDC director in 2009 during the outbreak of swine flu. I don't know if people remember, but you had these briefings almost every day, much like the president and Drs. Fauci and Birx are having as well. What lessons did you learn during that swine flu outbreak that you believe could be applied today? Perhaps the Trump administration could learn from what you all went through then.
Yeah, Willie, that's a terrific question. I think one of the critical success factors back then was trust. And the way we engendered trust was having a daily briefing from the top public health officials in the country. And what allowed us to do was talk about what we were learning, why we were changing guidance when we were changing guidance. It's critically important because in a pandemic, in a new emerging infection, what you don't know greatly outweighs what you do know. And so as you learn and you change your guidance, if you're not having that direct line of sight to the science, people will wonder, well, what's going on here? Who's in charge? Why are you waffling and flipping? The CDC and state and local public health are learning a ton, but we're not hearing from them every day. We're hearing from political leaders, and that is a real problem.
Dr. Besser, I'm just curious what you thought of the president sort of talking about this light and disinfectant being shot into the body, and then his top scientists having to sort of deal with that. Are you at all concerned that the framework at the top in the White House is not best set up to win against this virus with a president who comes up with ideas like that? And what did you think of that idea?
Mika, I think it's extremely dangerous when hypotheses, when ideas, when things that you may want someone to consider are put forward in that fashion. There's so much misinformation out there on the internet. You want to make sure that anything that's raised at a national level has been vetted, has been tested, and you know that it's something you want people to do. I worry when I see headlines that say president suggests using disinfectant, because some people will read that and say, oh, if it's being suggested, maybe I'll try it. The headline should all be that people should not use disinfectant. If people do that, lives will be lost. Scientific ideas need to come forward forward from scientists, and then have political leaders when you're looking to make a policy decision say, we're doing this because here is what our top scientists have said.
Mike Barnicle.
Doctor, one of the things the virus has done is breed fear and anxiety among certain elements of the population in this country and other countries around the world. You are trained as a pediatrician. What do you say to pregnant women right now? What do you say to parents of youngsters, infants 3 to 5 years of age, people 7, 8, 9, 10 years of age, and their exposure to the virus? What do you say?
Yeah. You know, it's natural that people are worried, that they're concerned. When you can give people things to do to reduce their risk, that helps. When it comes to talking to children, it depends very much on the age of the child. So very young children, you want to shield them as much as possible from news. As children get older, as parents, as caregivers, you want to reassure them that you are taking care of them and looking out for their health. As you get older, preteen and teen children, you want to give them things to do, ways to engage, things they may be able to do even remotely in their community so that there's sense of control and action. That can all be very helpful. But, you know, this is going to pay a big toll on children's education, on their learning, on their development. And we need to stay focused on doing those things that can help to reduce the impact at that level.
But is it factual to claim, as some have claimed, that children are unlikely to catch the virus?
Well, you know, there's a lot that we need to learn about children. One of the key questions is how important are children in terms of transmission? For flu, for influenza, we know that children are a critically important way that virus spreads through communities. It spreads to elderly people. We don't have the same information around children in this outbreak, and that will be very relevant when you think about opening schools and how big a risk factor that is. In terms of children not getting infected, no, you know, what is known is that children are at much lower risk of having severe disease and fatal disease. It doesn't mean that some children won't have severe disease, unfortunately, or die, but the risk of that happening is much, much lower. And this idea of risk is one that's really challenging to convey because it doesn't mean that it's not going to happen. But we're doing all of these activities because of the great risk to the elderly and those with certain underlying conditions. And if we all take action, that's what we can do. We can reduce the risk to those who are really in trouble with this.
Dr. Besser, as we talk about those communities who are vulnerable, senior citizens, people with underlying conditions, often left out of the conversation are people with disabilities. And I know you've been thinking a lot about that and writing about that recently, that there are massive populations of people with disabilities who are vulnerable right now. We just had a nearly $500 billion bill passed through Congress to address the problem in front of us. What can you say about how people with disabilities in this country are having their needs addressed, either through government or through private groups?
Well, I think if you look at the legislation that's been passed, you'd have to conclude from that as a society, we don't put the same value on people with disabilities. 60 million people in this country with disabilities, more than that. But if you look at some of the unmet needs, family and medical leave, a lot of home health workers who help care for people with disabilities are not in the workforce now. Yet family and medical leave policies don't allow people to stay home and help care for people with disabilities. That's something that has to change. People with disabilities need to be able to have long stockpiles of medications and medical equipment. Yet, you know, while Medicare is allowing 90-day prescriptions, that hasn't been expanded to Medicaid and CHIP and some of the other programs. Those are critically important. And then when you look at some of the decision making that healthcare systems are making as they're planning of how to ration scarce resources, people with disabilities, their lives are not valued in the same way, and that's just wrong. We need to change that. We need to look at these bills and make sure that the needs of people with disabilities are being met, that information is being conveyed to people in ways that everybody can get that information and protect their lives.
Dr. Richard Besser, thank you so much for coming on. Would love to have you back again soon.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.